welcome to episode 1 of Ready, Steady, Rehab on Wisp Sports Radio.
When I told you I was going to give you advice.
Ready, Steady, Rehab is an all-new podcast about sports injuries, what can cause them, the symptoms to look out for, and rehabilitation process.
Well, you can't see me through those innocent eyes. You're too far away to let me down.
Welcome to the new show. I'm Dr. Heather North, a doctor of physical therapy, and on today's episode, we'll be talking about why see a physical therapist for your care and what you can expect. Before we get into the topic, though, I'd like to tell you something about myself and my practice. I own Red Hammer Rehab. I'm also a physical therapist here. It's a small sports orthopedic practice just outside of Boulder, Colorado, in the lovely little town of Louisville. And I started the practice about 5 years ago. We are an out-of-network practice, which means that we really believe that it's important to focus on patient-centered care and not necessarily worry about insurance telling us exactly what to do. We really focus on long appointments with patients, really trying to see patients only for a few visits, which limits their expense and expedites the whole process of them getting healthy. So we have one other physical therapist that works for us. His name is Dr. Michael Morrison. He went to grad school with me. He's spectacular. Our practice really focuses on treating the active individual, anything from weekend warriors, young athletes in high school and middle school, to Olympians, to world-class athletes, to older individuals that just want to stay active with their grandchildren. So we love what we do. I'm a runner myself. I swam in college, and I still enjoy staying active and really like to pass that on to my patients and understand that they like to stay active and healthy as well. So, all right, so what we're going to talk about today is why see a physical therapist. And in today's day and age, we are doctors of physical therapy, which basically means that we have a little bit more education than previous decades. Grad schools are spitting out doctors of physical therapy that have extensive knowledge, radiology, pharmacology, differential diagnosis. I went to school for 9 semesters and had a lot of wonderful, wonderful education that allows us to be a doctoring profession. And the American Physical Therapy Association has something called Vision 2020, which kind of sounds dorky, but it actually is really important. They want to make physical therapy a doctoring profession by that year, which is coming up pretty quickly, which is absolutely crazy. And in all states right now, as of January 1, 2015, every physical therapist can be seen without a prescription from their physician, which means they're direct access. You definitely want to check with your insurance company just to make sure that you don't need a prescription in order to get your insurance reimbursement. But that's a huge, huge movement for us in our doctoring profession. We really have a lot of knowledge that can help diagnose things. So if you come to see us with a musculoskeletal injury and you haven't been to the emergency room or your primary care, we are a great place to start. And I always tell patients, obviously, if you've been in a traumatic accident where you think there might be internal bleeding, head trauma, bones sticking out, stuff like that, obviously go to see an actual medical doctor. But for kind of run-of-the-mill injuries, Achilles tendonitis, falls, knee pain, shoulder pain, minor accidents, things like that. Seeing a doctor of physical therapy first is a really wonderful first line of defense. And it actually will save you money. Everyone loves to save money, right? So with most insurance companies, if you go to see the emergency room, you have a huge deductible up front. So seeing a physical therapist, even if you have to have cash pay, might set you back $100, $150. And we can tell you, do you have a meniscus tear? Do you not have a meniscus tear? Do you have a broken bone? Do you not have a broken bone? And we can also refer you out. So tables are kind of turning a little bit right now. So instead of an orthopedic surgeon sending me a patient saying, oh my God, I don't know why this patient's here. They don't have any broken bones. They don't have any knee damage. You're going to start physical therapy. The patient actually will see us directly, and they can get their treatment started. But yeah, in most states right now, we can even prescribe imaging. So it just makes everything much, much quicker. I will see a patient if I'm thinking that they may have a meniscus tear, instead of sending them to see the knee specialist, and then they have to spend a lot of money at that specialist. They can get their MRI, we can get that diagnosis, and we can get them scheduled for surgery if need be ASAP, which is wonderful. So it saves money long term, and it's quicker, more expert care. So and nothing against medical doctors, they're wonderful. And we all have our place in the medical system. Medical doctors know, especially primary cares, they know a lot about, they know a little about a lot of things, okay? And as physical therapists, we know a lot about our specialized piece of the pie. So, just as a surgeon is a specialist in surgery, giving injections, things like that, we are really specialists of the musculoskeletal system, nervous system, things like that. So I want to give a good example to help you guys understand a little bit about how this would work. So we are going to talk about patient Barbara. Barbara plays basketball. She is in an intramural league, and she loves playing with her coworkers. And towards the end of the game, she made this fantastic three-pointer, and it won the game. Everyone was so excited. But unfortunately, when Barbara landed, she turned her ankle really badly. And Barbara is really concerned that she might have a broken bone. But Barbara listened to Wisp Sports, and she knows that, maybe I will go ahead and see my local doctor of physical therapy. So Barbara made an appointment the next morning to come on in, and she came in to see us, and we can tell Barbara, oh my goodness, okay, we're going to run you through the specific tests. Barbara does not have a broken bone. We can tell with almost 99% assurance that she does not have that broken bone. So instead of Barbara going to the emergency room late last night, staying there until 3 in the morning just to get an overpriced brace and an x-ray, and being told to stay off of it for 3 or 4 weeks, she can actually start her evidence-based rehabilitation today. We know that it's really important to get going, get moving as soon as possible. So Barbara's going to begin today with basic ankle range of motion. We're going to get rid of all of that swelling. We're going to get her moving. And hopefully by the end of the week, Barbara can start walking and maybe doing a little bit of jogging. She can also get her ankle manipulated in our office. We do grade 5 manipulations as doctors of physical therapy, which a lot of people don't realize. We can do some dry needling to affect her inflammation. So dry needling helps to create a little bit of microtrauma to the tissue. And the body responds to that microtrauma by drawing in blood flow. We can even finish up the appointment with a little bit of interferential electrical stimulation to help draw blood flow into the area. So now here Barbara is the next day. She has a huge, wonderful plan of care. Her inflammation is way down. She's not feeling like her entire basketball season with her coworkers is interrupted. And she also knows that she does not have a broken bone. Barbara can also save a ton of money. So instead of her $500 deductible at the emergency room, she's only spent a couple of $100s with us, with maybe 2 to 3 visits maximum. It's really important to I think, understand also the difference between a cash pay practice or out of network and in network. Out of network practices, they don't get reimbursed directly from insurance. That way we're not beholden to insurance, which again really means that we can focus on patient-centered care. And there's nothing wrong with insurance-based practices. They're just limited a little bit more because they have to hire people to get insurance reimbursement directly, medical billers, I think that's what they're called. And so they just can't spend quite as much one-on-one time with a patient, but they have wonderful doctors of physical therapy. And if your only way of seeing a physical therapist is insurance, that's absolutely fine too. Just make sure you get a good physical therapist that specializes in manual therapy with dry needling. So you can really see in this episode why we're talking about seeing a physical therapist first. What you're going to see as the medical system changes, we will save patients money, we will have better outcomes. And again, we can always refer to medical doctors, to surgeons, to make sure that patients are getting the best care possible. And that's always my primary focus, is taking really wonderful care of my patients and making sure that they get back to what they love doing quicker. I hope you found this helpful. And if you would like more information, please visit my website at redhammerrehab.com. It's provided on the show notes, and you can also email info@wispsports.com with any questions you have about sports injuries. On the next episode, I'm going to be addressing a popular topic of what to do about the infamous low back pain. There will also be links in the show notes accompanying the episode at wispsports.com. Just go to listen and click on Ready, Steady, Rehab. For more conversations from the world of women's sport, visit wispsports.com and subscribe to Wisp Sports Radio on your podcast player. That's important. You can also post your comments and share on social media. Just look for @Red Hammer Rehab and @Wisp Sports. Thanks so much for listening and supporting women in sport everywhere.